crisis did not erupt overnight. The demands of these doctors are legitimate. There is a combination of factors that is driving this crisis. Let's start with the root cause of the problem: medical colleges. There aren't enough of them. India needs more colleges and more doctors. It's a bit of a vicious cycle. The government tries to increase the number of seats in MBBS courses, but who is going to train these extra students? There are not enough teachers to ensure quality education. Sample these numbers. This year, as many as 2,750 seats will be added to MBBS courses in 25 new government colleges. This will be the biggest ever addition to government MBBS courses in India. The private sector is pitching in too. 10 new colleges will add about 1,500 seats. These 35 colleges will need more than 3,000 faculty members to teach the extra students. Do they have that many teachers? The short answer is no. In 2018, a total of 23 medical colleges, both government and private, were added. The minimum faculty requirement for these was 2,000. In 2017, 13 colleges were opened. They needed more than 1,100 faculty members. Similarly, in 2016, 30 new colleges came up. The faculty requirement for this was 3,000. If you add all of this, from 2016 onwards, more than 100 medical colleges have been added in India. They need more than 9,000 teachers. The question is, where are these teachers? The next question: how does this, what we've just discussed, affect the situation at hand? A shortage of good teachers in medical education has compromised quality and promoted unethical practices. What do private colleges do? At least some of them. They've been caught hiring ghost faculty just to get licenses. Such institutions hinder India's ability to create good doctors. This shortage then is reflected in hospitals. There aren't enough good doctors and hospitals to treat Indians. Government hospitals are overcrowded across the country. According to a report in 2017, there is less than one doctor for 1,000 people in India. Less than one for 1,000, which is why mishaps happen. Proper care is hard to come by. The medical staff is stretched. When things go wrong, violence erupts. Doctors are abused, they're beaten up. Patients say they're being denied health care. And this problem is not limited to West Bengal. Look at AIIMS, India's premier medical institute in New Delhi. In 2013 and 14, there were as many as 32 cases of workplace violence recorded at the All India Institute of Medical Sciences. A lot of these cases, 38% to be exact, were witnessed in the casualty ward. And in 91% of these cases, those responsible for the violence were not punished. The doctors on strike today are protesting against all of this. They want an assurance of safety while they work. We must tell you that this problem is not unique to India. Incidents of violence against doctors are reported elsewhere too, in other countries too, including countries like America, the United Kingdom and China, and their numbers are rising too. A recent survey in America found that nearly half of the doctors were assaulted on the job. More than 3,500 doctors were part of this survey. In China, a study spread across 10 provinces came up with some shocking results. More than half of the physicians were verbally abused, 1/3 were threatened, and more than 3% were physically assaulted in the past 12 months. So what are these countries doing to tackle the problem? Can Indian authorities follow some of those measures? In America, 30 states have passed laws making assault against medical professionals a felony. Basically, it's a crime to attack a doctor or a nurse in these states. It is punishable by law. Beyond that, experts recommend several interventions like more security officers, more CCTV cameras with observers and so on. In the United Kingdom, some hospitals have started training medical professionals in conflict resolution. Security in medical establishments has also been stepped up, and in rare cases, patients are excluded from the National Health Trust. Remember, the UK has free health care for all citizens, so such a punishment means that the patient will be cut off from several healthcare benefits. China is adopting a different approach. The Chinese state is trying to promote the concept of family physicians. Basically, this is a trained family doctor to treat mild illnesses at least. China feels this will help in reducing overcrowding in hospitals and create a personal connect. But by the looks of it, no country has been able to successfully address the problem of angry relatives venting on doctors. India will have to find a solution sooner rather than later.